Planned Parenthood has been forced out of the Title X program because the Trump administration has instituted its unethical and we believe illegal Gag Rule, which would force our health care providers to limit the information that they provide our patients and not provide the full range of medical information that is available to them. And we won't put our healthcare providers in that position, and so we've been forced out of the program. The domestic gag rule that the Trump administration has implemented would require doctors to not provide abortion referrals or information about abortion to patients who are requesting it, and that is limiting the information, and it violates the medical ethics of our healthcare providers, and Planned Parenthood is not going to put our healthcare providers in that position. It's going to make it very difficult to access the care that Title X has provided for the last 50 years, and that includes cancer screenings, STI screenings, birth control. It's going to be harder to access birth control in this country. Planned Parenthood's doors are open. We are going to continue providing the care that our patients are seeking, but it is going to make it much more difficult. And that's what the Trump administration wants. If you look at all of the things that the Trump administration has done around health care, trying to get rid of the Affordable Care Act, supporting these extreme, egregious abortion bans around the country, and now trying to destroy the Title X program and limit access to reproductive health care, that's the world that the Trump administration wants to build. The Title X program is the nation's affordable reproductive health care program, and it is for the last 50 years provided access to health care for people in low-income communities, rural areas, and primarily people of color. And people of color, low-income communities, rural areas should have the same access to health care as everyone else. Your health care shouldn't be determined by your zip code. Impact across the country is going to vary. In areas like Cleveland, the Planned Parenthood there will no longer be able to deploy its mobile health care unit that has provided health education services about birth control, reproductive health care, and pregnancy tests. In states like Utah, where Planned Parenthood is the only Title X provider, or Minnesota, where we provide 90% of the Title X care, patients will be impacted. Our doors will be open. We will continue to see patients. But the truth is, it's going to be harder to access birth control and reproductive health services like cancer screenings, STI testing, harder than it has been in the past. This is a place where the federal government has stepped up. It's been a bipartisan program. Title X has been supported by both parties for the last 50 years, and healthcare really should be a nonpartisan issue, and it shouldn't be an area that is funded by charitable donations. And so, there are some areas, some states that have agreed to provide support as a backfill, and in some cases we will provide emergency funds, but again, this is really going to cause chaos in the system, and that's what the Trump administration is trying to do. Planned Parenthood sued the federal government in order to stop implementation, and we received an injunction that held implementation up for a short period of time, and we've been in court fighting and will continue to fight this Title X rule. And our supporters right now are calling their senators in every state in the country to get Congress to act. So there's no lack of action from Planned Parenthood. We are fighting this Title X rule, and we're going to continue to fight it.